You now, over the course of your career, must have been in this situation multiple times. Has your approach changed?
I find myself in a very funny position right now because I'm the psychiatrist on the team, and so oftentimes people come to me saying not wanting to know by their oncologist because they were too anxious, because they were too stressed, because they felt they were not ready. But 2 months later, 3 months later, after I've been working with them, they come to ask me, Dr. Al-Ozairi, have what do you think? How long do I have left? Or family members on the side coming to say, Dr. Al-Azari, how long uh, does my mom have or my wife have? And I'm not the person who's giving the prognosis, yet I find myself the best person in that place to do it. They're asking me directly, but I also know the prognosis because the oncologist has already mentioned it in his notes. Um, and having to break these bad news both to families and to patients. And people who are highly anxious and um, so I think the first thing that I always want to make sure is how much do they want to know. If they're calm, if there's anything I can do to maintain and respond to their feelings, and seeing how much do they want, both how much do they want to know, but also how much they know already. What is their beliefs? Um, do they think they might die in 3 months, or is it 3 years, or the realistic expectations? And so, oftentimes, asking before saying anything, and we talk about this ask, tell, ask method, but really, in practice, it becomes much more obvious in that the need to communicate and asking other people and not just the person, because oftentimes I found the parents or the family members have very different expectations than the patient themselves, and it becomes uh, a lot more awkward at times because you can have 10 years and 3 months in both the same patient.